Hey, good evening, everybody. My name is Dr. Nathan Thompson with Exemplified Health Center, your Wellness Way affiliate right here in Yorkville, Illinois. Happy Monday, guys. I hope you guys have had a great weekend. And thank you, as always, for joining me on our Monday Night Live. It's a little past 7:30. Apologize for getting on just a little bit late. But with anything, there's always some unseen events that take place. Let me know how your weekend was, guys. I had, I had an incredible day. Let me just say this, there's no such thing as good events, nor is there such thing as bad events. There's just events, and you get to choose whether it's going to be good or bad. So as we see some people that are jumping on, right now I'm going to be talking about Are Growing Pains Normal? And hopefully, you guys understand the sitcom that this is actually coming from, because it's called Growing Pains. And I'm going to talk about in just a little bit why kids have quote unquote growing pains. We go to the doctor and say that's just growing pains, and they'll outgrow it, and how we ignore it and how they actually turn into much bigger problems as adults. In fact, things that we actually see a lot in adults are actually problems that start as childhood. So I'm going to go over three main ones. I'm going to go over the first steps in order to how you can start to fix it. But also, if you decide that you're going to ignore it or has been ignored in your childhood, what it turns into, but also if you ignore it in your child's, what it will turn into and cause more pain and suffering, obviously down the road. So while we wait on people to jump on, if you are joining us, make sure that you say hello. Let me know where you're watching from right now. And if you're watching the replay, make sure that you hit replay and also where you're watching from. Guys, you guys will not believe this story. This is the kind of last 24 hours that I've had. So last night it was about 4:30, and I was actually in the shower, and my daughter bangs on the door. She's like, Dad, you got to take our cat. Her name is Charlie. You got to take her to the vet. I'm like, what happened? She said her tail got cut off. So one of our cats, yes, we do have more than one cat. The door, when one door opens, it creates suction in the house, and there's another door that was open to the back, and she was walking through and it slammed shut and it amputated her tail. And so last night I had to go to the animal hospital, and poor cat Charlie, she had to have half of her tail amputated. It was not good, and the bill was even worse. So I was actually up this morning at 4 a.m. to pick her up from the animal emergency room, having emergency surgery. And then I got into the office today, and it had rained here in Illinois quite a bit yesterday and like Saturday night, Sunday. And our roof in our office developed a leak, and we came in, and our ceiling tiles were all just absolutely drenched. And so we had a terrible roof leak. We didn't know about it because we weren't here. And so now we're actually dealing with that as well. So just like I said, guys, there is no such thing as good or bad events. They're just events, and you get to choose how you get to frame it. So all of these things, they happen for a reason. Sometimes I don't understand why, but they're all good because I choose for them to be good, and you can choose the same thing in your life as well. So guys, again, if you're joining us, please say hello. Please let us know where you're watching from, and if you're watching replay, just go ahead and hit replay, and also let me know where you're watching from. And we're going to go over Are Growing Pains Normal? Because that's what we think they are, and they are absolutely common, but they are not normal like a lot of health conditions that we talk about. Before I go into that and get into a little bit deeper, we want to welcome Dr. Brian Coker to our office. It was Dr. Brian's first day today. Dr. Brian is going to be working with us at our office as an associate, working right alongside me. Dr. Brian actually brings over 20 years of experience within the chiropractic profession. And he also has worked extensively with people who suffer with thyroid issues as well. Had tremendous success with that. And so we are just absolutely thrilled to have Dr. Brian come on board our team, working alongside everyone at the office. And we're excited so that he can start seeing patients, and we can continue to grow our office. Guys, it's full disclosure, there's so many people who want to come into the office, and we just can't handle that. So Dr. Brian will be doing a wonderful job as far as being able to handle patients. But more than that, we want to make sure, and the reason why we don't take on every new patient is because sometimes just with my capacity is I don't have necessarily the time and the energy that you deserve to be able to, for me to be able to take great care of you. That's the first and foremost thing, is that we never want to diminish the quality of care that we are able to give to our patients as well. So guys, give Dr. Brian a warm welcome. You will be seeing him with some of the live videos coming up, and we're super excited for him to start on this journey at Exemplify Health Center and being able to give great care to future patients especially. So I want to talk about growing pains, guys, because many times this is actually something that I suffered with quite a bit. I always wondered, going back to the whole, there's really just no good events, there's not bad events, they're just events, but I was one who suffered a lot with a lot of injury and a lot of quote unquote growing pains, and I always wondered, why me? And I understand now, because it actually helped me develop a deep empathy for people who are suffering from these things, but also it really started to drive a hunger to understand why these things were happening, so that people didn't have to suffer like I did. So I suffered with all of these conditions that I'm going to talk about: Sever's disease, knee issues, elbow issues, and they really never got resolved, and they turned into other injuries later on in life. But this comes from PubMed, and they call it growing pains, a non-inflammatory pain syndrome of early childhood. Now, the title of that I actually disagree with, because in order for there to be pain, there has to be inflammation. Remember, inflammatory chemicals actually will cause pain, okay? That's why if you give someone Tylenol, it actually blocks inflammatory chemicals, in which there actually can be tissue destruction, but it's blocking the inflammatory chemicals that are being secreted by the damaged tissue, and therefore you do not sense the pain within the actual nerve system. So in order for there to be pain, there has to be some kind of inflammation that's actually going on. So the first thing I want you to understand is if your child has any of these following conditions that are going on, then yes, 100%, absolutely, they are inflamed, okay? Now, here's what they say regarding growing pains. The growing pains that they're talking about in this article, is I actually suffer from this greatly, is the kind of like at night, when your child gets a dull, boring, deep type pain, like within the shins, for example, and it happens at night. And people say, well, why does it happen at night? Well, one of the reasons why is at night, because of cortisol and melatonin, healing is going to increase at night, and with that healing comes inflammation. That's why, guys, I always say, you wake up in the morning and you feel stiff, achy, because your body has had a lot of inflammation and healing to overcome, which is why I always say, if you don't want to be inflamed and feel achy in the morning, don't inflame yourself the couple of days before. Don't give a reason for your body to have to induce an inflammatory reaction to bring healing into that area. So this is why lifestyle can be so important, and be able to avoid those inflammatory triggers. So here's what they say. The term growing pains has been used for almost 200 years. And a lot of times it just means we call it growing pains because we don't know exactly what is going on. And it refers to the often severe, generally bilateral or on both sides, lower extremity, nocturnal or nighttime pains experienced by up to 1/3 of all children at some time during early childhood. Now, no clear mechanism has been identified that explains these pains, but there is an increasing body of evidence indicating that several factors, individually or in combination, might be responsible for this phenomenon. These include mechanical factors. So, is there a problem with the structure of the feet, the structure of the lower legs, usually is coming from the feet, actually? Are there such as joint hypermobility and flat feet? Interesting. So I'm going to talk about flat feet, and while we're absolutely destroying our kids' feet, and how we continue that pattern into destroying our feet as adults, which is why we have so many issues with our ankles, with our feet, with our bunions, with our plantar fasciitis, with our knee issues and our hip issues and things like that. Decreased pain threshold, reduced bone strength, and emotional factors involving the patient's family and other social stressors. Guys, they're even admitting there is an emotional component to pain, which there is 100%. That's why within our approach, we always talk about physical or mechanical. We talk about emotional or mental, and we also talk about a chemical aspect of inflammation. Now, Once the diagnosis has been established as having growing pains, conservative management using symptomatic pain medications. Well, wait a second, I thought they thought that it was non-inflammatory. Massage, and basically what massage is doing is providing a counter-irritant, because when you massage the legs, the nerve impulse through vibration will go quicker to the spinal cord than the sensation of dull pain, in which the spinal cord will then block the dull pain so that it can only feel the vibration. And other supportive measures should be employed until, now listen to this, the syndrome self-resolves with time. I always talk about it self-resolves, and I'm going to make an argument, meaning it never ever self-resolves. It moves to another area, especially we're going to talk about these injuries that I'm going to talk about in just a second. So pay attention, because it's going to get really interesting, okay? Now here's the three things that I want to talk about. And mainly I want to talk about this because I suffered with this tremendously when I was growing up. Number one, it's called Sever's disease. Sever's disease involves the back of the heel. Number two, Osgood-Schlatter's disease. This is actually when you have that bump that forms below the kneecap. And it's called the tibial tuberosity, or the bump on the tibia. And then also little league elbow, which is going to occur on the inside of the elbow. Now, why these occur is because that's actually the area of the bone that has not fused yet, and so it's actually a weaker area. And so what happens is when there is something specifically mechanical that's going on, those areas begin pulling abnormally on that what are known as a growth plate, and it starts to separate it, which is why you see a big bump on the heel, why you can see a bump on the elbow, and what you also can see a bump on the knee. And they say, well, just give it time and it will go away. But I'm going to show you is that it doesn't go away. Once that area actually fuses, it will move to different areas. Hopefully, guys, this makes sense. So the first one that I want to go over with you is actually Sever's disease. But before we talk about that, I want to talk about you go to an orthopedic doctor, and here's what they're going to do. They're going to say, you need to rest it, you need to ice it, and you need to take anti-inflammatories, and then you need to go on some kind of brace or some kind of support. That is pretty much clear across the board on what they're going to do. So they're going to rest it, which means there's a problem, but let's go ahead and just park it and not use it. And of course it's going to get better, but still the problem has not been addressed. It's kind of like saying this: I have a wheel, it's out of alignment, and so the more I drive it, the more it wears down. So my answer is I'm just going to take that car and I'm going to park it in the garage for 6 months, and I'm going to come back after 6 months and I say, holy cow, there's no wear on this tire anymore. It must be working. Well, of course it is, because you're not driving it. Number two is they're going to ice, which they're going to try to freeze the area in order to try to prevent the immune response from getting in there to try to heal that damaged tissue, or anti-inflammatories, which is not getting to the reason why. Guys, there's actually a lot of research out there that shows that actually taking anti-inflammatories actually delays the healing response. It takes a longer time in order to heal, because actually acute inflammation is how you bring healing into that area. And then also they're going to say, well, you need to be on some kind of brace or support. You need to be on some kind of derotational knee brace. You need to be on some kind of arch support or orthotics, or you need to be on some kind of brace or some kind of neoprene sleeve for the elbow. They actually will say nothing about, let's figure out what's happening mechanically to start fixing that. Let's address some of the chemical issues that could be going on as well. And let's start addressing some of the emotional factors that might be involved with all of these different things. It's just clear across the board: rest, ice, anti-inflammatories, braces, and supports, only to leave your child just hushing the symptoms. Meanwhile, the cause has never ever been addressed. So while traditionally they talk about doing these four things, I want to talk about doing something a little bit different. Why not we talk about actually alignment? Rather than park the car in the garage for 6 months, why don't we actually fix the tire and start addressing the alignment and some of the mechanical issues? So this can be caused by an alignment issue, especially when you're talking about the feet. A quarter of your skeleton is in the feet, which means that the feet are pretty doggone important as far as athletic performance, as far as movement, running, jumping, and a lot of where your power development is coming from the feet. You have a problem with the feet, you're going to have a problem with the knees. You have a problem with the knees, you're going to have a problem with the hip. You have a problem with the hip, you're going to have a problem in the lower part of the back. It's just how the body responds to gravity. So alignment's number one. Number two, you need to talk about flexibility, because a lot of times when you have tight tissues in those areas, because of the shoes that your child is wearing, because of the fact that they are actually not putting themselves in a position of those tissues to start to adapt, meaning they're sitting way too much, that can be a flexibility type issue as well. Number three can actually be just due to tissue resiliency, meaning that child doesn't do anything, and then all of a sudden you tell them to, hey, we're going to put you into soccer practice for 5 days a week, and the tissues have not had an opportunity to slowly adapt to the demands that's actually placed on it, so it gets very inflamed. And then number four, you also have to address why it's getting inflamed, and that can also be an issue that's happening chemically, okay? I will say this, is that many times when you start to get inflamed chemically, then where you will feel the inflammation a lot of times is in the areas that are actually misaligned or experiencing problems with flexibility. So a lot of times, that's the area that you will start to feel first. I'll give you a perfect example. I had a degenerative disc by the time I was 22 years of age. The radiologist looked at me and said, "What on earth have you been doing?" I'm like, this is the first time that I've actually felt it, but I live in such chronic pain. But I know that if my body gets inflamed, because I don't do the things that I am supposed to, the first thing that will always hurt is the area where I've had a pretty substantial injury, which is in the lower part of the back. So we're looking at things from a different perspective. We're looking at not trying to just hush the symptoms. We're actually trying to fix the reason why they're there in the first place. My question that I have is do these injuries just self-resolve? Because that's a lot of times to say, hey, let's just hush this up, and then hopefully, once they stop growing, these will just miraculously start to go away. And, Johnny comes in and his heel hurts, and then all of a sudden, he's done growing, and Johnny's heel doesn't hurt anymore. And you're like, hallelujah, I guess it healed itself. It's kind of a novel idea, right? The body can heal itself. But it doesn't necessarily heal itself. It just moves to another area of stress. So the reality is that these aren't just self-resolving. If you're doing nothing about it, what they're doing is turning into other things, okay? So the first one I want to talk to you about is I want to talk to you about Sever's disease, okay? So if your child tends to get pain in the back of the heel, and this particularly will happen with a lot of running and jumping and impact type movements. So a lot of times they will complain that, oh, it's not my Achilles tendon, it's the area where the Achilles tendon inserts into the heel, and it's that area right around it, and man, that it hurts. I remember mine would hurt so badly on both of my heels that I would actually wake up in the morning hardly able to walk. And so it made it very difficult to be able to participate in things like soccer or basketball, even hurt during baseball. And I would always ask my parents, can you please just rub it? It just hurts so badly, or just put some lotion on it, or some counter irritant, or even taking medications. And so, again, the doctor just said, hey, you got Sever's disease. This is just going to resolve itself. Here's what was never, ever looked at. And here's what you need to look at if your child is actually suffering this. Number one, you need to look at the alignment of the foot. So if your child, they stand, and you see that the arches are actually collapsing in, then the problem is you're going to see that is going to cause an increased stress on the area where the Achilles tendon actually inserts, and that tissue connects from the Achilles tendon around the heel and actually goes underneath and will connect to what's known as the plantar fascia, if you've ever heard of plantar fasciitis. So you actually have to look at feet alignment, which in my office, we actually do adjust a lot of people's feet. And so actually adjusting the heel, the bone above it, which is called the talus, the navicular, the cuboid bone, the cuneiforms, the metatarsals, those things actually need to be moving properly. And so many times, the doctor actually says, well, just throw an orthotic in there, and but they don't do anything with alignment of the feet. Number two, you have to look at the Achilles tendon, or the heel cord that comes from the calf, forms the Achilles tendon, and inserts into the heel, because many times the Achilles tendon will become very, very short. Now, one of the ways that you know this when it comes to kids, is have them perform a squat, and if they are leaning over excessively, or if they are coming up onto their toes, they have a really bad issue with Achilles tendon flexibility. And I would beg to say that a lot of kids do have very tight calves and very tight Achilles tendon. And it's not that it just gets tight on its own. A lot of it has to do with what the kids are wearing as far as footwear is concerned. Footwear is absolutely huge, because you'll see as people get older, it's almost as if they just keep getting more and more cushiony shoes with more and more a heel to toe drop. And the more that you keep doing that, the more it continues to shorten the Achilles tendon. And so we put kids in improper footwear. Number one, it's way too narrow on the toe box. And then number two, there's too big of a drop that's going from heel to toe. Not only that, we put people in these very cushiony shoes. The more cushion that you're putting on the bottom of the foot, the more that you will actually do, number four, decondition the muscles of the foot. And once the muscles of the foot become deconditioned, then they don't have the ability to be able to hold the arch up, and the foot starts to flatten, and then you start to see some problems take place. And then number five, also you got to address inflammatory triggers. If your child is eating garbage and junk food and has also developed a lot of food allergies, then the more that they are doing, the more that they will inflame their body, and then areas that are compromised will actually inflame first, especially if you are stressing it by playing a sport that's high impact, that requires proper footwear, Achilles tendon flexibility, and something that requires proper feet conditioning. Think soccer and think basketball, heck, even football too. So you have to address all those things, and this is what we do every single day. A lot of times when people come in, they're just thinking, well, maybe if you just like adjust it once, and then, maybe give your child a couple of stretches that we know that they're not going to do, because many times the parents don't do anything regarding their fitness as well. But we take people through a whole process to say, no, this is going to be addressed properly, because we don't want your child suffering with these things, especially down the road. So what does it turn into? Well, Dr. Nate, I had it and I'll grow it. The pain in my heels went away, but what it turned into is heel spurs. Yep, I've had it. So you see big bumps in the back of the heels. That's because the tendon has been pulled off of the bone, because it's an area known as a growth plate, okay? You will also develop Achilles tendonitis, and then the Achilles tendon connects to the plantar fascia. So how many people that you know have heel spurs, Achilles tendonitis, and or plantar fasciitis? And guys, we see so many people who come in who have those issues, and it's not necessarily just a stretching issue, especially because there's so much scarring that's taken place, and you actually have to completely change and reconstruct the foot. And this also can be even a mineral deficiency as well. One of the things that can actually exacerbate this is being magnesium deficient, because magnesium actually helps to relax fascia and things like that. But I have had all of those different things, and I'm wondering, why do I have all those things? Because I had them as a child, and it was never ever addressed properly by medical professionals, okay? So number two, I want you to talk to you about Osgood-Schlatter disease, okay? Now, Osgood-Schlatter disease is actually when you see this in kids who are still growing, and it's not pain right below the kneecap, it's not pain right above the kneecap, it's actually where this ligament, called the patellar ligament, inserts into an area that is still growing, which is about 2 inches or so below the bottom part of the kneecap, okay? How do you address that? Well, a lot of times they're going to try to do rest, they're going to try to do ice, put them in a derotational brace, but they never ever address why is this happening, okay? Now, again, you have to address foot alignment, because if the foot starts to fall or collapse, it will actually cause the knee or the bottom part of the leg to start rotating. You'll see the upper leg counter rotate, and then you'll have a tendon, instead of doing this, will start to go obliquely, and it will start pulling on where it inserts. So every time that they jump, every time that they sprint, every time that they're trying to take off on that foot, it's just abnormal pulling on that specific area where there's still the bone is growing, and it starts to pull it off, and then they develop a really big bump into that area. So feet are absolutely important. Another thing that you have to address is the area above here. This is known as the hip flexors. Guys, I will tell you this, we are so chronically hip flexor shortened, it is unbelievable. And the reason why is because we all sit. So kids sit, adults sit, we sit for a living. In fact, one of the things that you can see on how flexible your hip flexors are is go ahead and sit like on your bent knee and sit on your heels, and see if you can sit on your heels, and then see if you can actually lay all the way back by sitting on your heels and get your body to be able to touch behind you. And so many times you won't see people able to do that. And so if you're going to have tight hip flexors, remember these things too, there's a muscle that will actually cross over. So if you got chronically shortened hip flexors because your child is sitting all the time, then they are going to have a very, very tight area in through here that needs to be addressed. Number 3, proper jumping mechanics, okay? Here's what's so amazing is that they never ever teach how to actually jump correctly. And I remember in high school, my left knee killed like all the time. I have what was known as jumper's knee, which wasn't right here, it was right underneath the kneecap. And I remember I actually went back and looked at how I was jumping in high school, and every time that I jumped, my knee would bow in. My left knee would bow in, and all it was just pulling on that tendon all the time to where it would get very inflamed. And so one of the things that you need to teach kids is proper jumping mechanics known as the hip hinge. So this is like anything that you do with deadlifting or kettlebell swings, is that actually the butt, anytime you're initiating a jump, the butt should actually go back and the knees should actually go out. If you're having a problem going up and down the stairs and it hurts quite a bit, just try doing this. When you step up the stairs, don't let your knee, the inside of your knee, cave in, and focusing on moving your kneecap outside of your big toe. And you'll notice, wow, it doesn't hurt quite as bit. But kids should be taught on the proper way to actually jump, or they're just running into chronic issues. And then finally, the inflammatory triggers. Guys, this is why finding those inflammatory triggers, and a big thing for kids is actually them developing so many different food allergies, which is why food allergy testing is so important, okay? Now, if it's not addressed, it's not outgrown. It just turns into jumper's knee, which is then going to be right on the bottom part of the kneecap. Also, another one is patellar femoral syndrome, in which you start getting a wearing away of the cartilage underneath the kneecap. You will also develop tremendous pain right above the kneecap, and you can also develop what is known as IT band syndrome, which is this piece of fascia that goes from here all the way down to here, and it basically keeps your hip muscles, or your leg muscles, from rolling over to the side, but it's a big band of tissue, and it actually crosses over the kneecap. So you develop these problems because there's problems mechanically, there's problems with inflammation, there's problem with mobility, flexibility, there's a problem with the feet. So it's just time we got to stop just trying to calm and hush the symptoms and start to get to the reason why, because I guarantee if your child has it, it just turns into more problems later on in life, okay? Now here's something that's interesting. Little league elbow. Little league elbow, okay? Now they got a little bit smarter about this, but man, when I was growing up, it was like 150 pitches and then go out and pitch the next day. And that's one of the reasons why I was having reconstructive shoulder surgery with a torn labrum at 17 years of age, and I was done with my baseball career after that. So little league elbow is when you develop pain right on this side of the elbow, okay? And so it has to do with, they say, well, it's overuse from the throwing motion. But guys, it's not so much the throwing motion as a problem with shoulder mechanics. So one of the things that you have to look at is you have to look at shoulder and your thoracic spine up and through here as far as the alignment. Here's an easy way to know if your child is going to be on their way to developing little league elbow and further problems. is actually if you see that they have an increase in the rounding of their upper back, their shoulders are actually forward, and that is a recipe for developing some serious issues, because an elbow issue is never an elbow issue. It is really a shoulder issue, and it's just the elbow because of the shoulder issue that's taking all of the stress as a result. So you have to look at shoulder and upper thoracic spine flexibility and alignment. You have to look at shoulder flexibility. Guys, if your child does not have proper internal and external rotation, they're going to run into so many problems, because without this is what takes all of the stress. You have to look at thoracic and scapular strength. Guys, when you develop, and this is true in older people, a shoulder problem is not a shoulder problem. It's actually a spine and shoulder blade problem by far and away, because what sets where the shoulder is heading is really what's happening in your upper and mid back, and then also where the shoulder blade is actually positioned. We have such weak backs. It is incredible. And the reason why is you look at kids going to the gym, they never work on their backs. You have people who go to the gym, they never work on their backs. You have people who sit all the time in this rounded position, and they basically have, absolutely zero strength when it comes to their lower and into their upper backs. So they don't have the ability of this, the shoulder blade to even be strong to be able to hold it into a proper position. And then finally, like we always will say, inflammatory triggers, which is why this is even so important when it comes to things like food allergies and other inflammatory foods. So I had all of these things that were going on, but here's what it actually turned into. I had problems with Sever's disease. It turned into having a broken ankle and a reconstructed ankle, at 20 years of age, completely like whole joint reconstructed. I've had Achilles tendonitis. I have had plantar fasciitis. I've had an Achilles that was literally so swollen, I'm like, man, it's just a matter of time before this thing actually blows. And now it's actually doing great because I addressed the reason why it's happening. Same thing happens into the knee. Had terrible knee pain, had turned into jumper's knee. Then it started to migrate and go up to the upper part right above my kneecap. And I'm like, man, when am I going to have to need a knee replacement? Until I realized why that was happening. And the same thing as I suffered with Little League elbow all the time. It turned into chronic shoulder problems, eventually turned into dead arm syndrome, in which I couldn't even hardly throw anymore. It would cause tremendous amount of pain, tore the labrum into the shoulder, and then they went in and reconstructed it, but never got back to where I was actually supposed to be prior to the injury. So I outgrew them. They turned into other problems and turned into more problems and more pain and more medical expenses because it wasn't handled at the time. And I realized I'm going back about 30 years, so maybe they didn't have the understanding. But the great thing with social media is that now we can be able to blast this to everyone, and so you get an understanding. So what I always say is you don't really have an excuse anymore for your child suffering or for still having some of these issues that are going on, unless you want the same approach that was responsible for you to get sick in the first place. Remember, the definition of insanity, doing the same thing over and over, yet somehow expecting a different result. So, here's what Little League elbow turns into. Turns into a labrum tear, bicep tendonitis, bursitis, or having an impingement, especially if you do this and it really starts to hurt. Rotator cuff tears, or even Tommy John surgery, which a couple years ago was all the rage, in which little kids, like one of the fastest growing demographics, kids 15, 19 years of age, who are actually getting their ulnar collateral nerve reconstructed because they had this area overused. And basically what you had is you had athletically immature kids doing high-end athletic movements, and it led to a destruction of those tissues. Hopefully, guys, that makes sense. So here's what I think, because I see this all the time, and it really is a wake-up call, because basically what we have, especially with travel sports, especially with kids nowadays being one sport athletes when they're 8 years of age, we have an epidemic of physically underdeveloped, chronically inflamed, and athletically overused children. Let me say that again. We have an epidemic of physically underdeveloped, chronically inflamed, and athletically overused children. And now we're seeing kids who have so many injuries, and they're making billions of dollars, the orthopedics are, because they're not addressing the cause, and we have an industry that's actually forcing kids to be athletically overused, but to be massively, massively physically underdeveloped. This is why I say when it comes to kids, if your child can't do a 2-minute dead hang from a pull-up bar, if your child can't sit in a perfect squat position for 5 minutes at a time, they should not be learning how to pitch. They should not be, trying to learn how to dunk a basketball. They need to get back to the basics, because when you do that, you have to build an athlete first, and then after that, you can start to specialize. But the problem is we have kids specializing before they're actually athletically developed, okay? So, hey, can your child try this out? Hang from a bar for 2 minutes. Can they hang from a bar in this position? Do they actually have proper grip strength and shoulder strength to maintain that position? Can they perform a squat for 5 minutes? How about this? Can they do an overhead squat? So have them get a broomstick, hold it in this position, squat down, and hold it directly over their ears, their shoulders, their hips, and their feet, and be able to hold down in that position. Because what's so amazing is if you can't do it as a child, you won't be able to do it as an adult. Which is why when you look at the other aspect of fitness, we look at our gym, people come in and they can barely squat, they can't overhead squat, they can't hang from a bar for more than 10 seconds before their shoulders are killing them, they can't perform a squat, and a lot of times they're just like, man, I have a long way to go, I'm just going to give up. Don't give up. Start somewhere and start working on that, and be a work in progress your whole life and to work on getting it better. But we shouldn't have to reinvent the wheel when we're 35 years of age. We should be teaching it to our kids. And so if you don't teach it to their kids, they're going to have problems later on in life. And if you're watching this and don't do anything, then eventually, really, you can come down to saying, hey, it's going to be your fault, the reason why that's happening, okay? So here's some tips. So number one, train your child to be an athlete, not good at a sport, okay? Train your child to be an athlete first, not great at a sport, which means you have to teach them how to move correctly, and then you specialize after that. Number two, you can start doing this with your kids, is start changing out their footwear. So you should start with your kids giving them a shoe with a minimal heel drop. Most shoes that you see today will have about a 7 to 8, sometimes 9 millimeter heel to toe drop, which puts the heel at an angle. That actually changes the way that you jump, the way that you run, and also changes the way that you walk. Also, you should have something similar to a barefoot shoe that actually allows the toes to be able to spread out and not to force them into this small position, which is actually a reason why people develop bunions. So you should do that. Now, if you're 40 years of age, that's going to be a problem, and it can take a couple of years to change the foot. But any footwear that I wear has a large toe box that allows my toes to be able to spread out, and it has a minimum heel drop. So the shoes that I'm wearing, instead of having an 8 to 9 millimeter heel drop, it only has a 4 millimeter heel drop. You can start changing the way that you're wearing your shoes. But think about how we get older. You know, we go from wearing tennis shoes to running shoes, and then we get these giant New Balance or Nike Monarchs. Sorry guys if you're wearing them. But they're really the worst thing that you can wear, because we keep looking for something that is more comfortable. And it's like the person that wears a back brace all the time, is that, yeah, right now it may make it feel better, but essentially what you're doing is you're just making it weaker. So number three, chiropractic is huge. Chiropractic adjustments, especially when you're talking about the feet, the knees, the shoulders, actually the whole entire spine, but also working on mobility of the hips, mobility, being able to get full knee flexion, being able to actually get ankle mobility back as well, shoulder mobility back. And then number four, address the inflammatory triggers, especially when you're talking about kids, is start addressing food allergies. Because if they've been eating repetitively a lot of food, they've been eating a lot of junk food, they have been stressed, they've been on long-term antibiotics, in the past, that will increase the likelihood. There's a lot of inflammatory triggers in the form of food allergies. So why would you want to inflame your child more than they already are? And so you have to start addressing the physical and the chemical aspect when it comes to inflammation. So guys, if you enjoyed this video, please share it, especially, children who are suffering and they don't need to, or maybe you're an adult who is suffering because these things you thought you would outgrow just turned into something else. And so guys, once again, if you are from the Chicagoland area, guys, coming up tomorrow night, we're going to be talking about the first steps in order to regaining health freedom, and that is our approach to inflammation. So coming up at 6:15, it's tomorrow night, Tuesday, at Exemplify Health Center. We'll be doing our inflammation talk. This is an in-person event, and we're going to talk about where the sources of inflammation are, how do you test these things properly, how do you address them from a chemical, physical, from a mental perspective, because guys, nothing will heal unless you resolve the reason why inflammation is there in the first place. So whether you have problems with weight loss issues, problems with immune system issues like cancer, inflammatory issues leading to infertility, thyroid disease, arthritis, type 2 diabetes, autoimmune disease, any kind of hormone imbalance, guys, the thing that starts that, the thing that kicks all of that off is inflammation. And guys, we're not talking about the acute inflammation that you need to go through. We're talking about the chronic, unrelenting inflammation that you don't address, and it turns into the body adapting and causing these health conditions. Inflammation, chronic inflammation, is the spark that leads to every chronic degenerative disease out there, including your hormones. So guys, if you enjoy this, again, please make sure that you share this video as well. Please make sure that you say hello. Let me know where you're watching from. And if you're watching the replay, just go ahead and say replay and where you're watching from. I hope you guys have an awesome Monday evening. We'll be jumping on later on in the week. And guys, be well, be blessed, and remember who you are.